I think one of the attributes of this place is it is really kind of a one-stop shop. We have a lot under one roof, and what's not under this roof is pretty close to this roof.
It was very fast, the whole process, and efficient. I had my biopsy done the same exact day, and in 2 days I had the results. And that same week, I had already met with the surgeon. And from that point on, I was diagnosed January 10th, and my first chemo was January 22nd.
When you talk about taking care of a patient with cancer, you've got the medical oncologist who should be kind of in the middle directing the orchestra. But then there's lots of other medical professionals that are a part of that care, whether it be a surgeon or a radiation oncologist or a radiologist or a pathologist or an array of people that are involved. We are blessed to have all these people in close proximity to one another.
Imaging, chemo, radiation is very convenient for everything to be right there. It helps the communication better.
We recently moved to a new electronic medical record system, so patients who go to different subspecialties within the Baptist system, it becomes a streamlined process and overall results in better patient care.
Any physician in the Baptist system can look in the electronic medical record and they can see the imaging, they can see our office notes, they can see all the labs, and all the other ancillary physician notes are in there as well. So it's a very seamless system, and I think it creates better patient care.
I really felt a level of confidence because the hospital, the Montgomery Cancer Center, the other, even my own personal physician, were all interlinked together, communicating. So it wasn't just an immediate team, it was the whole system. It's like all of these pieces came together and were focused on me. That's the feeling that I received.
After I was diagnosed with both breast cancer and colon cancer, Dr. McDaniel said that he was going to present my case to the tumor board.
What we do is meet with other medical oncologists, radiation oncologists, surgeons, radiologists, pathologists, and we'll present interesting or unusual cases.
30, 40 or more people all on the same Zoom call studying every case. And when you can put the images up and you can put the pathology up and you can talk through that and you don't have one medical oncology opinion, you have 3 or 4 or 5 or 6, then the best outcome for the patient, or the best plan for the patient usually bubbles up to the top.
Cancer medicine is unique. There are very different scenarios. No patient is the same, and we recognize that. So we try to emphasize that we want to focus on how is this person's care going to be best delivered in our community.